Well, today we'll be talking about cataracts, and I am not alone. I have with me an optometrist. Her name is Oloako, well, Dr. Oloako Kola Olaliri. It's good to have you join us again.
Thank you so much for having me again. I'm very glad to be here.
Yes. Okay, so we're looking at cataract. So talk to us. What exactly is cataract?
Cataract is formed by protein deposits on the lens, which results in the cloudiness of the lens. That's pretty much what cataract is, and it can affect any person at any age. However, it's mostly known to affect people from age 40 and above.
All right, so let's talk about the symptoms now.
So pretty much, yeah, the symptoms of cataract are reduced vision both at day and at night, and particularly difficulty for people who have to drive at night because they can't take in the amount of light that oncoming vehicles provide. Yeah, that's it.
Oh, that's quite interesting. Can you talk to us about the prognosis? Like, how does it happen?
Cataract does not just come all at once, right? It's a progressive condition. Okay. So the condition, when it comes, when you notice that the vision is reduced, you need to visit your doctor. Now, there are tests that will be done, or examinations that will be done that will help to diagnose cataract, right? Now, once cataract is diagnosed, the patient needs to visit consistently for as much as 2 or 3 times in a year. Now, before the treatment proper is done, which is surgery, it could take like 2, 3, 4, or even 5 years, depending on the person. There are people who say that they don't want to, they take herbs and all that. I don't know about that, but really it progresses. Now, I'd like to define or describe cataract as having a curtain over a window. So here's what I mean. You know that a window is transparent when you don't have anything covering it, right? The cataract is like a curtain where the curtain begins to, or a blind begins to cover the window. Now, as you pull the blind, there's reduced light that comes in. That is how the simplest way I can describe cataract. So you pull the blind, there's reduced light, you know, the same thing. As the cataract grows, there's less, what the patient can see is reduced until it's time to take it out.
All right, you said until it's time to take it out, and I also remember you said 4 to 5 years. Does that mean we have to wait that long before the surgery is done?
Really, if the vision is still good, then there's really no point tampering with the cataract. But the more the patient visits, or as the patient keeps to his or her appointment, your doctor can tell you when it's time for the cataract to be taken out.
Now, if I look at the definition of cataract, it says it's a dense cloud that's formed on the lens of the eye. Does it mean that we can actually see it?
Yes, you can. Well, there are equipment that you can use to see the cataract formed and the type of cataract, the location of the cataract. Those are things that, well, our viewers may not understand, and really it's not of importance. Yeah. So, but the main thing is that there is something that is growing on the lens, and it is formed from protein deposits. You know, where they come from, really, we can't tell, but they are there, and they reduce the vision in the eye.
All right, I think this will take us to the causes. So what are the causes or risk factors, as the case may be?
Yeah, so causes of cataract, we don't exactly know. And that's almost the same thing for some other geriatric eye conditions. But the risk factors include overexposure to ultraviolet rays without wearing proper eye covering. So when you're going out under the sun, it's required that you have your pair of glasses that are properly treated to protect you from the sun. So you have your transition lenses or lenses that have been made to protect you from the sun, or you have a pair of sunglasses. 1, 2, people who have certain conditions like diabetes are prone to have cataract. People who take certain medication like steroids are prone to have cataracts, and that's why we say that people should not self-medicate, because that medicine you're buying over the counter has side effects that you don't know. But if it is prescribed, your doctor knows when to tell you to stop when to tell you to come, depending on what the condition is. But we find people just go by, it worked for me or it worked for my brother, and then they go buy the medicines without knowing that they are putting themselves or their eyes at risk for something else. Yeah.
All right, now I'd like you to, I know we talked about prognosis the other time, but can you specifically help us break down the outlook for anyone that has cataract? What does it look like for the person? What's the progression? What happens and all?
So for anyone that has cataract, the truth is that at some point, the vision is going to be very reduced. If we go by my description of the curtain, the blind and the window, when the blind is raised, there is light coming in. But as if we say the blind represents the cataract and the window the lens, right? As you pull the blind, it keeps covering. So as you pull the blind, it keeps covering. So it gets to a point where, yeah, the vision is totally reduced. Based on other factors, or all things being equal, after a cataract surgery, which I'm sure we might get there later, after a cataract surgery, a patient is supposed to see clearly, vision restored, right? But all things being equal, that means that the health of the eye has to be intact. That means the physical health has to be intact. That means that there is nothing else that is disturbing the eye, or there's no other damage by any other eye condition that has gone on. If there is nothing else, all things being equal, after a cataract surgery, trust me, the patient sees really well.
Very quickly, let's just brush up the types of cataract. Just very quickly, the one that a layman can understand.
There's congenital cataract, which is cataract that affects little children. Children can be born with cataract. Children can develop cataract. There's juvenile cataract for children who develop cataract while they're growing up, and this can be caused by different things. Some forms of congenital cataract are as a result of conditions that a mother might have had while she was pregnant, or some genetic disorder. Same with the juvenile cataract. Other forms of cataract are pretty much as a result of old age. Some forms of cataract can come because of accidents, but the rest, actually, whether it is nuclear, posterior, subcapsular, they are geriatric conditions that are age related. So, but then we also consider the risk factors, people who may have cataract, or underlying conditions, or because of medications that they have been using.
All right, let's look at the treatment now. Basically,
the main treatment for cataract really is surgery. When it is due to be taken out, your doctor will tell you. You go in for the surgery, and once it's done, the eyes are as good as new.
What's the success rate of the surgery?
Cataract surgeries have very high success rate, trust me, very, very high. And then the surgical procedures keep getting better over the years. So people are doing very well, very, very, very well. People used to be scared of going for cataract surgeries, but it's not the case these days. There's lots of hope that have been restored. There are and the government is doing well, because once in a while there are free surgeries that are conducted in the government-owned hospitals. There are some NGOs that also do free cataract surgeries, in the year and all that. What people just need to do is to pay attention to get to know when the information goes out, especially for those who can't afford to pay for the surgeries in the private hospitals, or even in the public hospitals, when the government is not doing some sort of free intervention. Yes. So yeah, I think that the success rate is really, really good. Like I said before, all things being equal, so long as there's no other condition in the eye that has caused reduced vision, the patient is good to go after the surgery.
All right, so from what you're saying now, the only treatment is surgery. No correction, nothing. It has to be surgery. And that surgery isn't done immediately. It's until the doctor feels it's time.
It depends on the level of growth of the cataract. But your doctor will advise you, because they look at the eye, they look at the back of the eye, look at the growth of the cataract and the way it is, and then can say, okay, yeah, it's time, we can take it out.
And when it is not taken out, what happens?
Vision keeps reducing. So a cataract patient knows that my vision is going to keep reducing until I go in for the surgery.
Okay. So, does it lead to blindness?
Cataract is one of the causes of avoidable blindness.